Hello, everybody. This is Dr. Matt Palladino, and this is a recording of the talk, the workshop that I gave at my office, Manchester Health and Spine, on Saturday, April 23rd. This is the second part of our gut health series. If you missed the first one, this is still going to make complete sense to you, but if you'd like, there is a recording of it that you can go back and find. So let's go ahead and jump right into it. The topic for this talk, for this workshop, was gut health and chronic disease. So just a little bit of a recap about what we talked about last month, that the health of the gut is vitally important. It is directly and indirectly related to virtually all areas of health, including our immune system, our brain, mental health, our energy levels, skin health, hormone issues. It has a lot to do with chronic health and chronic disease issues, things like fibromyalgia, autoimmune conditions, which we're going to get into later on in this talk. Another big important thing that we talked about is that digestion happens from north to south, which essentially means that digestion starts when the food enters our mouth and it slowly works down through different systems and gets broken down. And there's a snowball effect because if something is going on far up north with the breakdown of food in the mouth or in the stomach, then it can lead to problems further south in the GI tract in places like the small intestines and the large intestines. And so also it gets digested from north to south, but it also needs to be treated or corrected from north to south as well, so we can negate that snowball effect. And the other big thing that we talked about in the last workshop was maldigestion. Basically, all the problems you can have when food isn't properly digested, and there can be many different causes to that. And so today we're not going to get too much into that, but just know that if I talk about maldigestion, it's basically talking about the times when our food is not being broken down properly. Fats aren't being broken down, proteins aren't being broken down, carbohydrates aren't being broken down, and as they move through the GI tract, they can cause a lot of problems. So we're going to hop right in, talk a little bit about small intestine anatomy. So this is kind of what the inside of your small intestine looks like. So we call this the lumen. Another really important thing that we talked about is that the inside of the digestive tract is still considered the outside of the body, and get a little bit more into that later. But essentially, the small intestine is coated with these little finger-like projections called villi. And what those do is those create surface area, a lot of surface area for absorption of nutrients to happen in the small intestine. And so we're going to take a little zoomed in view of this. And as you can see, those villi, you can see my little cursor right here. These are those finger-like projections. And if we take a little picture of that right here and we zoom in on one of these villi right here, so you can see right here there's a border, and this border is 1 cell thick. And this is what separates the inside of our digestive tract, which is the outside of our body, with the inside of our body. You can see here these red is an artery, and then a blue is the vein. So these are a capillary bed, and inside is a lacteal, which is part of your lymph system. And then if we zoom in even further, one of these villi, you can see that there are these epithelial cells. They're called endocytes, and on top of them we call microvilli. And there's even a space right here called a tight junction that we're going to be talking about a little bit. And so food and nutrients and vitamins and minerals, they are absorbed through mechanisms. They're brought into the cells and then into the blood vessels here, and then they're carried off. The first place they go is to the liver. Some things get absorbed or pass into the body via these tight junctions right here. So that's a little bit of anatomy that we need to understand as we're moving forward. So the very first thing we're going to talk about is leaky gut. So leaky gut, first thing, it happens in the small intestine. So gut is kind of an ambiguous term that we use to talk about the GI tract. It doesn't happen really in the stomach. When we talk about leaky gut, we're talking about it in the small intestines. And it's essentially a major issue when the integrity of the gut lining of the small intestine breaks down and allows particles that are too large to pass through. So we look at this picture again. This is another zoomed in view here that we just talked about, another picture. So you can see right here these endocytes. This is what it should look like. And there's going to be stuff flowing through our small intestines. There's bacteria that lives in our small intestines. We eat food that contains a lot of different chemicals, some good, some bad. But over time, through some inflammation and damaging process, what can happen is these tight junctions start to open up, and then they allow particles through that are not supposed to end up inside our body. Some major causes and consequences of leaky gut, definitely dietary. So the standard American diet is a big one. Foods high in carbohydrates, high in sugars, high in nut and seed oil like vegetable oil, canola oil. Those are all things that can play a part in leaky gut. Gluten, we're going to be actually talking about gluten specifically here in a little bit, so I'm not going to get into that now. So GMOs, genetically modified foods, soda, alcohol, some different medications, antibiotics, chemo, radiation, stress, oxidative stress, heavy metals, toxins, pesticides, and then I added this one right here, lectins and oxalates, which are some different chemicals that are found in a lot of fruits. And they can really cause a lot of harm. Actually, lectins is a family of proteins, so gluten would be a lectin, but you also have lectins and other things. So, like we said before, leaky gut, it can lead to a lot of different health issues, lead to food intolerances, immune abnormalities, autoimmune conditions, things like MS, RA, Hashimoto's, which is hypothyroidism, lupus, Crohn's, heart disease, Parkinson's, cancer, osteoporosis. It can play a role in all sorts of different health-related issues. So it's a major thing that we need to know when we're talking about leaky gut and chronic disease. So many believe leaky gut to be the starting point, or at least a factor for virtually all autoimmune and chronic diseases. Like we just said, things like rheumatoid arthritis, Hashimoto's, skin issues, mental health, brain health, neurologic issues, and these are just the tip of the iceberg. When our gut starts to leak, letting stuff into our body that it's not supposed to be inside our body, it can just really wreak havoc. It can cause our immune system to flare up and cause all sorts of problems. Okay. So leaky gut, when foreign particles are allowed to enter the body, your body's own immune system flares up and attacks these particles. And that's what's supposed to happen. That's what the immune system does. Your immune system is its whole purpose is when stuff gets inside the body, whether it's a bacteria, a virus, whether it's a chemical, a particle, it flares up and it destroys it. Another big thing, the word inflammation gets thrown around a lot, and not a lot of people really, I guess, know what inflammation really is. And to the simplest effect, inflammation is an immune process that the body uses to replace or repair damaged cells or tissues. So if you're having a lot of inflammation in your body, it means that you're having a lot of damages to cells and to tissues, and your body is trying to repair or replace them, because when you have a lot of cells that are damaged, then your body's not going to work right. So when you have this junk that's leaking into the body via leaky gut, because the tight junctions are opening up and allowing, giving too much space for proteins and other particles from food to come inside the body. Some of these particles, they may embed themselves in the walls of your cells, and some of these particles look very much like proteins on our body's own cells. And this is called molecular mimicry. And this right here is why many people believe that leaky gut and autoimmune conditions go hand in hand, because our immune systems, what they do is they look for amino acid sequences. Essentially, that's how they recognize things, proteins that are floating around. And so some of the proteins in food, they look very, very, very similar to proteins that are hanging out on the outside of our cells. And so our immune system can get very confused. And when it gets confused, they just start attacking. So if you're having leaky gut, some proteins are leaking into your body, and these proteins look a lot like proteins that are found on cells in your joints, then your immune system will flare up and can start attacking the cells in your joints. So this would be something like rheumatoid arthritis, or if it's your thyroid, it'd be like Hashimoto's. And so molecular mimicry is basically a downstream issue, is what happens when proteins and other particles are entering into our body that they're not supposed to be there. Our immune system gets confused. It attacks those protein particles that are floating around, but then it can also attack. They can also then be trained to attack our own cells, and obviously that is not a good thing. Sometimes you hear people talk about, whether or not an autoimmune condition can be quote unquote cured. Personally, I do not think an autoimmune condition can be cured, but I do think it can be put into remission to where it's not causing an issue. Because once the immune system is trained to attack itself, you really can't untrain it. What you have to do is essentially not suppress it, but you just have to make it so it's not as flared up, not as hyperactive. And leaky gut can actually be tested. So, a lot of people don't realize this. They think it's just kind of like this ambiguous thing, but there's actually a test for it. It's a lactulose mannitol urine test. Essentially what you do is you drink both of those are like a sugar solution, and you look at the ratio between the two. The lactulose really should not be found in your urine, and the mannitol should. And so if too much lactulose is getting let through, we compare it to the amount of mannitol, and using that ratio we can tell, hey, is there leaky gut going on? Is there not? Also too, I'll say that leaky gut is somewhat of a gray, or maybe not gray, but there's a spectrum. It's not necessarily like you have it or you don't. You could not have it, you can have it a little bit, or you could have it moderately or severely, and actually this test allows us to know how severe it actually is. So this is an outside of a cell. So you can see here these yellow, I guess, chains hanging off. These would be proteins, and so these are what your body recognizes, your immune system recognizes right here. So sometimes it's believed that certain chemicals or proteins can actually embed themselves in the wall of the cell. If that happens, then your immune system just attacks the protein which is embedded in the cell wall, which then destroys the cell. Or sometimes it gets confused. It thinks a protein that is floating around that shouldn't be is actually one of these proteins that are hanging off the cell that the body makes itself, and then it then attacks the cell and destroys the cell. So that's called molecular mimicry, and that's one of the big reasons that leaky gut and autoimmune conditions are so interconnected. So getting a little bit into gluten. So gluten is a protein. It's actually a part of the lectin family. It's a protein that is found in a lot of wheat products. So proteins are made of a string of 20 different amino acids in varying sequences. So you can think of like a necklace of different beads, and they fold themselves over on each other. Actually, a lot of times proteins look like those old coiled phone cords that are all knotted and bunched up on each other. And so reason that gluten and thyroid go together so often, people who have gluten issues also struggle with Hashimoto's, is because the proteins on the cells of the thyroid are extremely similar in amino acid sequences when compared to gluten. So they just look very similar, and when that happens, we get the effect of the molecular mimicry. Another thing is zonulin is a protein that is produced by the body itself, and it regulates intestinal permeability. So what happens is if your body needs to allow immune cells into your GI tract, zonulin is released and it opens up those spaces, and it can also close them down. But one of the things that gluten seems to do is gluten stimulates zonulin release. So essentially what's happening is, you're eating gluten, which is a lectin, which is very harmful for the gut. You can get over time through inflammation, an immune response, you get a breakdown, and that cellular barrier starts to break down, and then the gluten opens up those spaces even more. And the more it opens up, the wider the doors open, the bigger and more particles can seep through into your bloodstream, causing more and more problems. So that's one of the reasons why gluten is such a big deal. I don't want to get too much into gluten, but why does gluten affect people now and it didn't 50, 60 years ago? And essentially a couple of things. One, I think people are just eating gluten more. Another reason is just our overall diets are causing a lot more gut problems and leaky gut, not just the gluten. And so with that being said, just more of an opportunity for gluten and other proteins to leach into the body to cause problems. And a third is gluten has been genetically modified, and the genetically modified gluten that we eat today seems to have a more negative effect on our body, on our GI tract, than the gluten that we ate 50, 60, 100 years ago. They've done studies that have looked at comparing, um, I'll say, modern wheat and gluten to gluten that was eaten a long time ago, and there's definitely some major differences between the two. Um, so leaky gut, just to sum up, leaky gut is essentially our body's immune system gets confused, and it can attack itself. Must heal the gut and calm the immune system. So we talked a little bit about that already. But leaky gut, yes, is a major issue and in autoimmune conditions. So if you're having an autoimmune condition, um, you definitely need to be looking at your gut health. If you're not looking at your gut health, if you're just looking, if you're just getting put on drugs to, I guess, suppress your immune system and not looking at your gut health, I mean, that's really not looking to solve the root cause of the issue. It's just suppressing your immune system. And in my opinion, that's not a really good way to dealing with autoimmune conditions. So we need to heal the gut. We need to make sure that stuff isn't leaching in and causing more and more problems. So we're going to talk a little bit about what's called gut flora. Right now, gut flora is very popular. There's a couple different names. Gut flora is another name for the good or for the bacteria in your intestines. There's bacteria basically throughout all of your GI tract. Most of it is housed in your large intestine. Another term for it is microbiome. If you hear about people talking about probiotics, these are all kind of the same names for different things. So I wanted to use them and just point them out. That way, if you're reading an article and it's talking about gut flora, if it talks about the microbiome, it talks about probiotics, it talks about good bacteria, that they're all essentially the names for the same name for the same names for the same thing, essentially. So the microbiome is defined as the bacteria, viruses, and fungi that inhabit the human body. It's collectively referred to as a second human genome. The gut microbiome in particular is now considered to be a separate organ with distinct metabolic and immune activity. We know now that it is extremely important. It plays a lot of roles. And this is fascinating right here. There are 10 times the number of microbial cells in the human gut than in the whole body, totaling roughly 100 trillion microbes, representing as many as 5,000 different species and weighing approximately 2 kilograms. That's about 4.5 pounds for us Americans. But that's how important they are. There's 10 times the number of basically bacteria cells than in our whole body. So we live in a very symbiotic relationship with each other, and so you have to make sure that we're having the best possible gut flora health, because if not, it can cause a lot of problems. Um, Gut bacteria are involved in many functions like harvesting energy from food, helping break down food, balancing the good versus bad bacteria composition, manufacturing neurotransmitters such as serotonin. Enzyme and vitamins like vitamin K are involved with the immune system and metabolic functions. Good bacteria is essential to good health. There's a lot of links now to the benefits of good bacteria to chronic disease, to autoimmune conditions, to mental health. Everything goes hand in hand. Gut issues can be very complicated and complex. Um, the gut flora can also be related, can have an effect on leaky gut. And a lot of times too, if someone has leaky gut, they also have an imbalance of gut flora. So the imbalance of gut flora, is called dysbiosis, and it's when the normal balance of healthy gut bacteria has become out of balance. Common causes to this: antibiotics. I've worked with a lot of patients over the years that have had a lot of chronic health issues, and one really common theme that a lot of these patients who have things like fibromyalgia, maybe rheumatoid arthritis, chronic health issues, are a lot of them have been on a lot of antibiotics when they were young. And at this point, and what those antibiotics do is they kill bacteria, and they can actually kill the beneficial bacteria in your gut as well, and that can lead to the overgrowth of the bad stuff. And so at this point, if you get on an antibiotic, if you need to go on an antibiotic, you really, really, really need to be taking a probiotic with it as well. I mean, that should just be a given at this point. We know so much about the importance of the benefits of the good bacteria. If you're on antibiotic, you essentially have to be taking a probiotic to help repopulate the good bacteria. Think of it, it's like if your lawn, if you go and you kill all the grass and then you don't put new grass seed down, what's going to happen? Weeds are going to sprout up all over the place. Things like alcohol, diet high in refined carbohydrates. So bacteria, just like us, need different food for fuel. And bacteria that feed off of sugars a lot of times are not beneficial to us. But if we're constantly eating a diet high in sugars and refined carbohydrates, what's going to happen is we're going to feed the bad bacteria, and the more we feed them, the more they're going to grow, and they're going to crowd out and kill off the good bacteria, the beneficial bacteria. There's some prescription and over-the-counter drugs that can kill off the good bacteria and lead to an imbalance. Things like stress, chronic inflammation. Like we talked about, inflammation is the body's immune process where it tries to replace, repair damaged cells or tissues. So it can be a lot of different causes to dysbiosis and gut issues. And one thing that I've found working with patients over the years who have a lot of gut issues is generally there's not one thing that's causing it. It's a combination of many, many different things over time. And that's why they can be pretty complicated. And that's why we do testing to see what needs to be done in order to balance out the gut. Because you can have leaky gut, you can have dysbiosis, you can have maldigestion that are all going hand in hand. And oftentimes just taking a probiotic isn't going to be enough. So to show you a couple things, more than a couple, but some different health issues that stem from dysbiosis, you can see abdominal pain, allergic reactions, anxiety, bad breath, belching, bloating, stomach rumbling, excessive flatulence, chest pain, constipation, diarrhea, depression, difficulty urinating, dizziness, fatigue, gynecological disorders, yeast infections, hair loss, having trouble concentrating, heart failure, increased sweating, irregular bowel movements, nail deformity, nausea, nervousness, rash and skin problems, strong flatulence and fluctuations in appetites, thickened tongue, upset stomach, vaginal rectal itching, overall weakness. And that's a lot of stuff. And that's just from the dysbiosis, from the bacteria being out of balance. And a lot of these things you might not, or most people might not even realize go back to their gut. I mean, you could have a patient that has something like they have anxiety, they're having hair loss issues, they're having a lot of nervousness, depression, and they might not even think that it might be related to a gut issue, but we know how vitally important this good bacteria is. And so that's why it's so important if you're having a lot of health issues that you're seeing a doctor that can put all this stuff together, and you're not just going to a doctor who's just looking at one symptom and treating you for just one thing. We need to treat the whole body in a very holistic manner. So can you talk about dysbiosis? Correcting dysbiosis generally takes more than just taking a probiotic. It can definitely help, and usually I do put people on a probiotic, but dysbiosis is usually a downstream issue, meaning there's some other things we need to take care of. Diet changes and proper digestion must also be present. You know, if you're having a lot of gut issues, the one thing I can tell you is you're going to need to make diet changes. If you are not making dietary changes, you're just putting a Band-Aid on it, and it's going to continue to get worse. And if you're not digesting food well, it could be that you're not eating the right food. It could be some problems with some of the digestive glands aren't releasing the proper enzymes or bile salts. So there's all sorts of things going on. But generally, dysbiosis is a downstream issue, and it usually goes hand in hand with other digestive issues as well. So a little bit, there's kind of a subcategory of dysbiosis called, you might see, it's called SIBO. I wanted to hit on small intestinal bacterial overgrowth. Like I said, you actually have bacteria that goes all through your entire GI tract, essentially. Majority of it is in the large intestines, but if it can actually overgrow in your small intestines, and it can lead to a lot of problems. It can lead to things like diarrhea, nausea, bloating, vomiting, weight loss, fatigue. It's not on this picture, but one thing I see a lot is reflux too with people who have SIBO. So all sorts of problems if you're getting bacteria growing where it shouldn't be. So what causes SIBO? It can be things like not being able to digest food properly, undigested food moving through the digestive tract can feed bacteria, and they can start to grow and populate in places where they shouldn't be. Diets high in sugar and carbohydrates feeding those bad bacteria. Medications like antibiotics and birth control can lead to overgrowth of bacteria. And this is another one that's kind of interesting to people. Sometimes probiotics can actually cause SIBO. So what's happening is, when we're talking digestion happens north to south, you take a probiotic, which is essentially a supplement that's filled with different types of bacteria, and as it moves through your GI tract, you want the bacteria to basically end up in your large intestines. I have one thing can happen if you have SIBO is people who take probiotics, so they have a lot of bacteria in their small intestines. It'll actually make things worse because that bacteria is moving through and creating problems and going places it shouldn't be. That's why if you're on a probiotic, you need to make sure that you're on one that guarantees delivery to where it should be. So the one that I recommend in my office, it guarantees delivery to the large intestines where majority of the gut flora should be, and also comes with a prebiotic, which is basically food for the good bacteria. So if you are having GI issues and someone recommended that you take a probiotic, and you feel like it makes you worse, it gives you diarrhea, or it gives you maybe bloating or acid reflux, and it just makes it seem like it flares your gut issues up, makes it worse, then I would say very good chance you have some small intestinal bacterial overgrowth going on in your system. So what do we do for this? Some different types of diet. So we have like a biphasic diet and an elemental diet, and essentially what those do is those kind of starve out the bad bacteria, and once they die off, then we can then repopulate the GI tract with good bacteria. Different antimicrobial agents. There's different things. So like, you've heard people say apple cider vinegar. They drink it, helps their gut. Why? Because it helps to kill off some of the bad bacteria. If it's really, really severe, you can take antibiotics for it. Prokinetics, things that increase gastric motility. That basically is stuff moves through the small intestines faster, can help push stuff out, push stuff through, and stuff doesn't get stuck, or it just moves through at the speed it should. And obviously pre and probiotics, which we talked about. Those are all things that there's different ways that we can treat SIBO, but really one of the best ways is with a diet. We have to change the diet. We have to basically starve out these bad bacteria that thrive off of things like sugars and simple carbohydrates. And then we have to repopulate with pro and prebiotics. And that's really the best way to deal with a lot of these gut issues when we're talking about the bacteria. Healing your gut. So one great thing about the body is that it's programmed to heal, but you must remove stressors and provide building blocks for repair. So essentially, when we are dealing with gut issues, we have to stop doing what's harming it. And so what that looks like is what we talked about: diet, removing the stressors. You may need to stop drinking alcohol. You may need to stop eating Twinkies and ice cream, things that are causing the problems in the first place. We need to give our body the opportunity to heal, because we keep damaging it. It's just never going to heal because you keep injuring it over and over. We need to remove and avoid things like lectins, alcohol, sugars, linoleic acid, oxalates. If it can be different for different people, and that's one of the reasons why some gut issues can be difficult. What worked for one person doesn't necessarily work for another person. Supplements like glutamine and zinc can be used to help the body repair the damaged intestinal barrier. So this is us giving the body the building blocks, things that it needs specifically to repair. If you're going to build a brick wall, you have to have supplies. You have to have bricks. You have to have mortar in order to build a wall. And so if we want our gut to repair itself, we have to give it what it needs. We need to give it the building blocks. We need to reestablish proper gut bacteria using pre and probiotics. It'll take more than one single change for you to heal your gut. Like I said, many gut issues, by the time people start having problems, They have more than one problem. It's very common for someone to have dysbiosis, for them to have leaky gut, for them to have maldigestion, to have all these different problems going on. And you can't just say, well, I'm just going to remove one thing from my diet and then it's all going to go away. So that's one of the reasons why we do testing to see what all is going on. And I'll get into that here in just another minute. Oh, wait, here it is. So one of the tests that I do with patients that I've had a lot of good success with is a test by Genova Diagnostics called GIFX, and it's a comprehensive stool profile, and essentially it looks for 5 major areas. So maldigestion, it looks to see, hey, are you breaking down the food the way you're supposed to break it down? Looking at your pancreatic enzymes to see if proteins are breaking down, looking at the amount of fats in your stool. And so what it does is it lets us know ways that you can help us too. Hey, do you need to be taking digestive enzymes? Do you need to take bile salts, some HCl, apple cider vinegar? What are some things that are going to help you break down food, and so you're not having these undigested food particles floating through your GI tract causing problems? Is there a lot of inflammation? Like we said, is your body's immune system really flared up? And we have some immune markers here, and it lets us know the level of inflammation, and then things that you can do to help to rectify it, to reduce the inflammation. Lets us know dysbiosis. If you should be taking a pre or probiotic. Lets us know metabolic imbalances. Your short chain fatty acids. Do you need to be taking a prebiotic? Do you need to be taking fiber, starches, increased fermented food? Should be taking some different supplements. It lets us know if there's metabolic imbalances going on in the GI tract. And then lastly, is there an infection? So do you have a parasite? Do you have a yeast overgrowth? Do you have more like a pathogenic bacteria going on, like more of an actual infection going on in your gut, more than that's just dysbiosis? And let me just get back to this dysbiosis real quick. I recently did one of these stool profiles on a patient, and she had been on a probiotic that another doctor had recommended, and I'm not saying it was good or bad, but what essentially happened was this right here was the category that she needed help with the most, was the dysbiosis. So put her on a different probiotic and recommended some other things to her to help balance out this bacteria. But this is a really, really great test, and we're dealing with a functional medicine type approach to helping people with gut issues and GI issues, because it lets us know. I talk with a lot of people who go to maybe their family doctor or even a GI specialist, and they'll be like, well, they did a celiac test and tested for infection, and they said that everything looked good, so they just told me to take a probiotic. They started taking a probiotic, and guess what? It didn't really help. So this comprehensive stool profile is a really, really good option where we get to see exactly what's going on, and we can give you practical steps that we need in order to heal and balance out your gut. Hopefully you learned some things. I didn't necessarily get too in depth into some of the things, like we talked about leaky gut, we talked about dysbiosis, but just know it goes far beyond what I talked about here. And I'm actually working on another video specifically about leaky gut. So hopefully, if you're something you're into or want to learn more about, that'll be a really in-depth look at leaky gut and how it affects our bodies. One thing too that I didn't necessarily talk about, but we can get, you can actually get, if you have leaky gut and really bad dysbiosis, you can get what we call endotoxemia, and that's where these bad bacteria are releasing some really nasty toxins, some byproducts that they release, and that leach into the body, and those can really wreak havoc on the body as well. So if you're having chronic health issues, whether it's an autoimmune condition, maybe a thyroid issue, if you're having like a lot of problems with depression, with anxiety, and you're just not happy with where you're at, with maybe the care you're receiving, and you want to take a more functional, holistic approach where we're looking at the whole body, where we really need to start is with the digestive tract, just to make sure everything is working good, you're digesting food. This test too, I will say, even though it does not directly measure leaky gut with the lactulose mannitol test, it actually will tell us if you have basically an intestinal barrier dysfunction essentially. So this test will actually lets us know too if you need some leaky gut support as well. So this is, like I said, this was the second part of our GI health discussion. Hopefully you learned something. And if you have any questions, shoot us a message. If you have any questions about the testing, shoot us a message. If you think you have a friend that's having a lot of GI issues, hey, send them this video, have them watch it. If you want to look at the other one, you can go to our Facebook page and it should be scroll up and post it, or you can look on this YouTube channel and you'll see the part one where we talk a little bit more about digestion. I hope everyone has a great day, and I will talk to you soon.